Chapter 4: Infectious Diseases. Bacterial infections. Condition: impetigo. Cause: Staphylococcus aureus or occasionally Staphylococcus pyogenes. Mostly common seen in children. The location is the skin and most commonly on the face and extremities. Clinical features include vesicles or crusted lesions, and the treatment is topical or systemic antibiotics and is diagnosed clinically or in the laboratory. Tonsillitis and pharyngitis is caused by Streptococcus pyogenes, but can be caused by other bacteria and viruses. It occurs in children as well as adults and is located in the posterior oral cavity, the tonsils, or the oropharynx. Clinical features include enlarged tonsils and mucosal erythema. Treatment is systemic antibiotic if it's caused by a bacteria, and it can be diagnosed clinically or in the laboratory. Tuberculosis, also known as TB, is caused by Mycobacterium tuberculosis. Its location of the primary infection is lungs, and the bacteria can also spread throughout the body. It can manifest as oral lesions, although these are rare. These are painful, non-healing, slowly enlarging, deep or superficial ulcers, and most commonly located on the tongue and the palate. Microscopically, they appear as granulomas containing the causative organism. The treatment is a combination anti-tuberculosis agent, and it can be diagnosed in the laboratory or microscopically. Actinomycosis, caused by Actinomyces israeli. It's located on the skin and oral mucosa, and clinically it appears as a draining abscess. Microscopic features include bacterial colonies in tissue from the lesion, and its treatment includes a long-term high-dose antibiotic therapy and is diagnosed clinically and microscopically. Syphilis, caused by Treptonemia pallidum, usually seen in sexually active adults but can also infect the fetus through the mother congenitally. The primary site is a site of inoculation, and the secondary site is a diffuse lesion of skin and mucous membranes. Tertiary include cardiovascular system, central nervous system, and oral lesions may occur. Clinically, the oral lesions appear as primary, called the chancre, and the secondary is mucous patches, and tertiary includes guma. Microscopically, the skin is dark field identification of spirochetes. Treatment include antibiotic agents, usually penicillin, and can be diagnosed clinically and in the laboratory. Necrotizing ulcerative gingivitis, caused by Borrelia vincenti plus fusiform bacteria. It occurs in adolescent and adults. Its location is on the gingiva, and clinically it appears as painful erythemic gingivitis with necrosis and cratering in the interdental papilla, foul odor, and metallic taste. It can also be accompanied by a fever and cervical lymphadenopathy. The treatment is an antibiotic agent, debridement of necrotic tissue, and oral hygiene care, and can be diagnosed clinically. Pericoronitis. This is caused by an inflammatory process, usually by bacterial infection, and is most common in adolescents and young adults at the eruption of third molars. The tissue around the crown of the partially erupted impacted tooth is the location, and clinically it appears as an erythemic, painful, swollen tissue around the crown of the partially erupted tooth. Radiographically, the impacted tooth can be seen on the radiograph, and the treatment includes a debridement and irrigation, antibiotic therapy, and extraction of the impacted tooth, and it can be diagnosed clinically. Acute osteomyelitis, caused by bacterial infection, is located in the bone. Radiographically, there are no radiographic changes unless present for more than 1 week. Microscopically, a non-vital bone, necrotic debris, and acute inflammation, as well as bacterial colonies are present. It can be treated with an antibiotic therapy or drainage of the area, and can be diagnosed clinically and in the laboratory. Chronic osteomyelitis is also caused by a bacterial infection. It's also located in the bone, but clinically you can actually see the involved bone is painful and swelled. Radiographically, you see some irregular radiolucencies, and microscopically, you can see chronic inflammation of bone and bone marrow. The treatment includes a debridement, antibiotic therapy, and hyperbaric oxygen, and it can be diagnosed clinically, in the laboratory, or also radiographically. Verruca vulgaris, caused by the human papillomavirus. It's seen in children and adults and is located on the skin and lips, most commonly in oral locations. The clinical features include a white papillary exophytic lesion resembling a papilloma, and microscopically, you see finger-like projections of keratonic squamous epithelium with central cores of well-vascularized fibrotic connective tissue, as well as cells with clear cytoplasm in the upper spinous layer. Treatment includes surgical excision, immunologic staining to identify presence of the papillomavirus, and may reoccur. Diagnosis includes microscopic. Condyloma acuminatum, also caused by the human papillomavirus. It's usually found in adults and is located on the oral mucosa in any location. Clinically, it appears as a pink papillary lesion, usually more diffuse than papillomas or verruca vulgaris, and there may be multiple lesions. Microscopically, there's a thickening of the epithelium with finger-like projections covering cores of connective tissue. The cells with clear cytoplasm are seen throughout the epithelium. The treatment is a surgical excision, and recurrence is common and can be diagnosed microscopically. Multifocal epithelial hyperplasia, also caused by the human papillomavirus. It occurs in children, is located on the oral mucosa. Clinically, it appears as multiple whitish to pale pink nodules distributed throughout the oral mucosa. Microscopically, there's a thickening of the epithelial with broad connective reed bridges, and the cells are clear cytoplasm seen in the epithelium. The treatment is self-limited to the disease, and it can be diagnosed clinically or microscopically. Primary herpetic gingivostomitis, caused by the herpes simplex virus. Most oral infections are type 1 and some are type 2, generally seen in children and is less common in adolescents and adults. It's located on the lips, the gingiva, and oral mucosa. Clinical features include multiple tiny vesicles that progress to form painful ulcers, painful erythemic swollen gingiva, and fever, nausea, cervical lymphadenopathy, and microscopically, virally altered epithelial cells in mucosal smears or biopsy tissue. The treatment is self-limited to the disease, and the diagnostic process includes clinical as well as microscopic. Recurrent herpes simplex infection, caused by the herpes simplex virus, usually seen in adolescent and adults. The location of the herpes labialis is the vermilion border of the lips, and recurrent intraoral forms appear on the keratinized mucosa, including the palate and the gingiva. Clinically, this appears as focal crops as tiny vesicles that coalesce in forms of a single ulcer and predominant symptoms. The clinical or the microscopic features include virally altered epithelial cells in mucosal smears or biopsy tissue. It's self-limited disease and it can be diagnosed clinically. Chickenpox, caused by the varicella zoster virus, usually seen in children, is less common in adolescent and adults. It occurs on the skin as well as the mucous membrane and appears as vesicular and pustular eruptions. Oral lesions usually do not cause severe discomfort. Microscopically, virally altered epithelial cells in mucosal smears or biopsy tissue. It's a self-limited disease, and the diagnosis process is clinical. Herpes zoster, caused by the varicella zoster virus, occurs in adults, located on the skin and mucous membrane. Clinically, it appears as a unilateral distribution of painful vesicles along with sensory nerve predominant symptoms. Microscopically, virally altered epithelial cells in mucosal smears or biopsy tissue. The treatment is an antiviral agent and also corticosteroids and can be diagnosed clinically. Infectious mononucleosis, caused by the Epstein-Barr virus, usually occurs in adolescent and young adults. It's a systemic disease, and its clinical features include a palatal petechia, sore throat, fever, generalized lymphadenopathy, enlarged spleen, malaise, and also fatigue. Microscopically, atypical white blood cells and cells in blood. And also, this is a self-limiting disease and can be diagnosed in the laboratory. Herpangina, caused by the Coxsackie virus, usually occurring in young children and adults. It appears on the soft palate. The clinical features include fever, malaise, and soft vesicles on the soft palate. It's a self-limiting disease and is diagnosed clinically. Hand, foot, and mouth disease, also caused by the Coxsackie virus. It affects children under the age of 5. It appears on the oral mucosa as well as the skin of the hands, feet, and fingers. Its clinical features include oral lesions, vesicles anywhere in the mouth. It's a self-limiting disease and it can be diagnosed clinically. Acute lymphonodular pharyngitis. Caused by the Coxsackie virus, it appears in children as nodule lesions on the soft palate and tonsillar area. Clinically, you can have sore throat, fever, mild headache, and oral lesions in the posterior oral cavity. It's self-limiting and can be diagnosed clinically. Measles, caused by the parazymovirus, most commonly occurring in children, primarily occurring on the skin and sometimes the oral mucosa for the early lesions. Clinical features include oral mucosa, cup-like spots, erythema macules with white necrotic centers. It's a self-limiting disease and can be diagnosed clinically. Mumps, also caused by the paramyxovirus, commonly occurring in children. Its location is the salivary glands, and clinically it appears as painful, usually bilaterally enlargement of salivary glands. It's self-limiting and can be diagnosed clinically. HIV and AIDS, caused by the immune deficiency resulting from an infection with the human immunodeficiency virus. It affects newborns all the way to adults. It's a systemic disease, and the clinical features include opportunistic diseases, oral manifestations including oral candiditis, herpes simplex infections, herpes zoster, hairy papillomavirus lesions, Kaposi sarcoma, lymphoma, atypical periodontal disease, major aphthous-like ulcer, salivary gland disease, xerostomia, and mucosal pigmentation. Autoimmune type is thrombocytopenia, may result in spontaneous gingival bleeding. Radiographically, severe and rapid bone loss seen in atypical periodontal disease. Microscopically is dependent on the opportunistic disease. Treatment includes combination antiretroviral agents, management of specific opportunistic disease, and can be diagnosed in the laboratory as well as microscopically.